Talk a bit about psoriasis and my experience of using LDN with psoriasis, and hopefully it'll help other people with psoriasis just to give them another option of treatment, since obviously I had quite a good success with it. So, just a bit about psoriasis. It affects approximately 2% of the UK population in varying degrees. It's a chronic skin condition which causes basically red scaly patches to appear. And it's quite uncomfortable. It can be if it's all over, which is what I had. It's related to the immune system, but I think it's not known exactly how it's related, really. So current treatments involve steroid creams, various ointments, moisturisers. There are some immune system drugs out there at the moment. I think they haven't been tested over the long term, and they have quite a lot of side effects. So I've never been keen to try those, really. Obviously, it can affect, physical effects are easy to see, but if it's quite considerable coverage of psoriasis, then it can have other emotional and personal effects too. So I started getting psoriasis when I was about 21, 22, funnily enough, when I was at Penn State University studying over there. So I wasn't aware they were doing the research at the time, unfortunately. Started just a small patch on my neck, and then gradually over the next couple of months spread everywhere, basically arms, legs, body, face, scalp, everywhere you can think of, really. So pretty much covered. Not a very comfortable condition to have, really, but I tried to not let it affect anything I did, really, day to day, but for some people it can affect the day-to-day living. So I tried various creams, ointments, steroid creams, UVB light treatments, which was quite successful, but don't want to repeat it too many times, I don't think. Different diets, gluten-free diets, juicing, herbal remedies, acupuncture, pretty much everything you could think of, but nothing really worked to great effect. Obviously, some treatments work better than others, and everything varies for different people. Some things work better. So I was looking for something else to try, basically. So after doing a lot of trailing around on the internet, I discovered LDN about a year ago, and decided to give it a try, because obviously there's no side effects as far as I can see anyway. So I visited the Central Health Clinic in Glasgow and started off taking on the lowest dose, and gradually over the next few months increased the dosage. After about 3 months, I was kind of thinking, oh, it's not really working, couldn't see any effect really. No great improvement, but I thought I would continue taking it, obviously, because there's no side effects I could see. So after about 5 or 6 months, my skin was clearing, and all the red patch was getting less red, basically less itchy and uncomfortable, and it was very beneficial. So some pictures for the evidence. On the left, obviously, you can see on my face, I had it all over my face on both sides, forehead. Psoriasis can vary, so in the summer it would get better sometimes because with the sunlight it can improve. But on the right hand side, I think it's a bit of better photo actually. That was probably my camera phone, and the other one was a decent camera, but you can see obviously completely cleared on my face anyway. That's just on my back before. On the left hand side it was pretty much covered, and on the right hand side a few months later. It's not a great photo, but you can kind of see obviously on the left hand side is all covered in red patches, and it was actually, I think that was about after 2 or 3 months of taking it, so that's not the worst it's been. But my legs now are completely clear, so it's a luxury to have skin back, to be honest. So just in conclusion, LDN definitely works for me. I've actually been off it for a few months now because I'm expecting a baby in February. It didn't kind of mix with morning sickness at the time, so but it seems to have a prolonged effect. So at the moment my skin hasn't come back very much over the last 4 or 5 months. It stayed pretty constant, which is good. So it hasn't suddenly all come back, which is great. and hopefully it can help a lot of other people with psoriasis. And I was actually talking to my GP yesterday for something else, and she mentioned she'd be prescribing LDN for MS, but didn't realise it might work for psoriasis. So hopefully I can educate her and get her to try it on some other people. So that's it.
Okay.